I'm glad you're here talking about it, because so often people feel ashamed, right? And
Yeah.
I mean, you're confused and you're ashamed about depression and mistakenly believe that, look, I just got to gut it up here. I've got to overcome it using willpower alone.
It is so true. The stigma around depression is so great. There are so many treatment options that are available. There are many medications that are available, different types. There is psychotherapy that is available. There are many forms of that. And you mentioned one, which is a brain stimulating therapy, electroconvulsive therapy, or ECT. These things can be used by themselves or in combination. And it sounds as though you've done what many people must do, and that is go through a number of these therapies, alone or in combination, to find just the right one for you.
Would you say in your general course of things you're doing better, or you're doing worse than you were, say, 2 years ago?
I've definitely come a long way. You know, I've gone from around 17 medications down to about 4, which is great progress.
We often think, sometimes people think depressed people, like I said, are just lazy. Just like, look, get over it. You know, just come on, quit whining, get over it. But depression is a real disorder with very real consequences.
Depressive illnesses are brain disorders. And now, luckily, with advances in brain imaging and other technologies, we really have a chance to see that what happens in people with depression are changes in their brains.
Let me show you, because Don, I want you to really think about this. If you guys were out hiking and she broke her leg, you wouldn't just leave her behind.
No,
say, well, yeah, you can't walk, bye. You know, you wouldn't do that. And when you think about the brain, you've got to, depression, you got to think about it in the same way. You can't see it just looking at her, but if you look at the normal brain versus the depressed brain, they're very different. In the normal brain, you know, this frontal lobe area here is where you have kind of higher order thinking and reasoning and processing, and you can see how different it is in the depressed brain. And then you've got the temporal lobes here, and this is where you have emotions are centered in here, and some of the aspects that have to do with your feeling. And you can see over here, concomitantly in a depressed brain, it's much darker. And then this is the thalamus in the middle of the brain, and you see over here, again, it's shut down. So it's kind of like, you know, you talk about depression, you don't feel the lightness, you don't feel the energy, you don't feel the activity.
Exactly.
That's what you'd see if there was a broken leg and you look at an x-ray. We now have that ability to do the same thing with the brain.
I do want to say, though, that we've got a ways to go with this. As
We do.
exciting as these advances are, these brain imaging technologies can't do a couple of things. First of all, they can't tell us why depression occurs. And second is that they're not typically used yet to diagnose depression or to help guide treatment.
So how do you distinguish just regular sadness from depression? Talk about that a little bit.
You know, that is so important, because some people say, you know, well, I should be sad, right? And it's okay. But there's some really important diagnostic criteria, things that your doctor would use, signs and symptoms that you would share with them that would help differentiate from come to a normal sadness from a major depression. What needs to happen is you would have 5 of these or more that would occur for a 2-week period or more in order for the depression diagnosis. So the first one is feeling sad or empty or tearful most of the day, every day. So this is a profound sadness. The second is loss of interest in things that used to bring you pleasure. Being outside, doing things, don't bring you pleasure anymore. A significant change in appetite, and that can either be up or down, and usually has some weight loss that goes along with it, or weight gain if your appetite's up. The other thing is trouble sleeping. Some people have trouble sleeping, others sleep far too much, like all day, can't get themselves up and moving. Fatigue and lack of energy is also really an important key. And feelings of hopelessness, helplessness, worthlessness, guilt, those things plague you during the day. Reduced ability to concentrate, to think, to make decisions, just, you know, can't quite focus. And agitation, restlessness, or irritability. These things also occur. And last but absolutely not least are recurrent thoughts, these thoughts that won't go away around death and suicide.
And if you see on the graphic that we have up here, we checked off all but one for you. Your weight's been pretty stable.
Yeah, thank goodness.
Yeah, but other than that, we've checked almost everyone off for those, which means you're dealing with a major depressive episode. But that doesn't mean that it tells the whole story. And listen, everybody we have on here is in a way a teaching tool. And I hope this has given you guys some insight at home and in the audience today. If you suspect a loved one is battling depression, the most important thing you can do is help them get a diagnosis and treatment. Don't just feel like, come on, I gotta be tough. You offer emotional support and understanding. Never ignore comments about suicide. This old adage that people that talk about it don't do it is not true. That is a myth. Do not believe that. And if you are depressed and suicidal, call the 24-hour National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255.
And this is so true. There is so much help that is available. And the good news for you, Noelle, and for others who suffer from depression is that there are many options that are available. And I have to applaud you for raising your hand, asking for help, inspiring others to do that, and also for sticking with it and really working hard, both of you, to get your depression treated so that you can feel better. Lots of information to know about depression, and for more information, you can go to gethealthystayhealthy.com. There's information there on both depression and other illnesses.